you've chosen to watch Spinal Diagnosis. How many patients do you see with complaints of, oh, my neck hurts or oh, my back hurts? The correct physical examination maneuvers are crucial to define the work injury. Just like any other part that we examine, active range of motion is important. Here we examine the 6 planes of range of motion of the cervical spine: chin to the chest flexion, chin to the shoulder left lateral rotation, chin to the other shoulder right lateral rotation, and then with the ear to the left and the ear to the right, lateral bends. The last motion determined is cervical extension. These are the ranges of motions you should record, and as you treat, should get better over time. Let's take a look at the proper physical examination for a cervical spine. Let's look closely at the 3 things that a cervical spine nerve injury would present with: a reflex problem, a motor problem, and a sensory problem. Let's look first at the reflexes. With a patient comfortably sitting in front of you, arms on his lap, one can palpate the biceps tendon, placing your own finger over that and palpating with a reflex hammer the biceps tendon. One can see a proper biceps jerk or a biceps reflex. Demonstrating the same reflex arc is the brachioradialis reflex. This is demonstrated here as well. Now let's take a look at the triceps reflex, a C7 and C8 radicular problem. With the arms akimbo at the side, one can gently feel about a finger breadth up from the olecranon, tap it with a reflex hammer. Brisk triceps reflex in this gentleman as well. A normal reflex. Compare the left versus the right and record it. So now let's do the next thing that peripheral nerves do in the cervical spine. We've looked at reflex, let's do motor exam. Here, there's only 3 nerves that really matter: the ones that control the biceps, triceps, and your wrist motion, both up and down or volar dorsiflexion. Here's how you examine the biceps function. Hand against the chest wall, have him maximally flex his elbow. Now you want to try and break it with 2 fingers at the wrist. You should not be able to break a normal biceps motor function. Compare the normal to the abnormal side. Same position. Now look what happens when you slowly put pressure. He gives way in a slow, consistent manner. This is biceps motor function weakness. Now let's go to the next muscle down, triceps. Same position, hand on the chest wall. Now controlling his hand and wrist, have him actively extend his elbow or try and straighten it. Normal side versus abnormal side. You should be able to clinically detect some motor weakness. He won't be able to push as hard on the abnormal side. The last group of muscles are confluent, wrist dorsiflexors and volar flexors. Here, grabbing 2 fingers, holding your fingers, you can see what we're trying to do when we move his hands up and down. When he wants to actively fire those or squeeze tight on your fingers, he won't be able to move his wrists up and down. That's normal 5 out of 5 motor strength. No weakness detected right versus left side. Let's do the last thing, sensory examination. Fingertip palpation is all that is needed. No special equipment. Right side versus left side in the autogenous zones for a C5 root, C6 root, and C7 root. Those are the areas that are most commonly tested for cervical spine problems. The last part of the cervical examination is actually done from the backside. One should know some anatomy in the back. The very prominent vertebral prominence sticks out just about in anybody. That's C7. Putting your finger on there and palpating straight up are all your spinous processes. By palpating those, one can find interspinous tenderness. When palpating right, slightly to the right or slightly to the left, you get erector spinae tenderness or spasm in acute injuries. This is something you need to examine for and document. And no examination in the cervical spine would be complete without a provocative test. Classically, that's a Sperling's maneuver, classically done from behind the patient, arms over his head, and an axial compression on the cervical spine. If there's a radiculopathy present, this should provoke the right kind of clinical response. Your documentation and your clinical notes of the pertinent positives and the important negatives is how you and Texas Mutual will define this work injury. We need you to document right versus left. We need you to document upper or lower spinal area. It's the only way we can tell of what is injured and what is not. Thank you for watching Workplace Diagnosis.